I'm not going to sit here and tell you I've read through this bill. I've seen pictures of it. It's this high. And no, I haven't read through the bill, but I've read some commentaries from people that have read through the bill, and there's some absolutely scary items in there for me. Yes, abortion payment and actually terminating the aged. Definitely, you'll be forced to pay for things that you just morally don't agree with. One thing that's happening, and I'm experiencing it personally with my own mother's health care, is since this bill has passed, and it's just been, a couple of weeks, there are physicians that are taking action already, and to be expected. The paperwork and all of just the paper shuffling that has to be dealt with socialized medicine, with the federal government right in the middle of it, is just overwhelming for a private practitioner. What you're going to run the private practitioners. We are going to run the private practitioners right out of business. And the fact is that this doctor is getting out of her private practice immediately, end of the month, and she's going to another town out of this region, and she's going to be an employee underneath an organization that's big enough to be able to shuffle the paperwork. And therefore, my mom is going to be, she's going to lose her doctor that she's had for years, and it's a shame. You know, with socialized medicine, you have the incentive the incentive for excellence is removed. When I talked with a young guy, he came down from Canada, and he was doing some work with some students in the local area down there near Plains, and he hurt his knee, and he went to the local hospital. It happened to be where I worked, and after he found out that I worked there, he was all happy about going to the hospital that I worked. And I asked him, well, why were you so excited about going to the hospital there? And he says, well, I got treated in 15 minutes, and I was seen in 15 minutes. I waited 15 minutes in the waiting room, and then I was seen that day and was given treatment and was able to go home. And I said, really, what's the big deal about that? He said, well, if I was in Canada and it wasn't a real emergency like that, I wouldn't be seen same day at all. And I said, there's the difference. We work hard to see patients within 10 or 15 minutes. They don't sit in the waiting room for a long time. Why? Because we compete. We compete with the local hospitals. There's another hospital 45 miles away. There's another hospital 70 miles away. There's another hospital 90 miles away. If we make people sit in the waiting room for an hour or for a half an hour, they're going to get back in their car and go find a hospital where they can be treated. And if there's no incentive for us to excel, which there isn't, I mean, if there's really no incentive, then why shouldn't the patient, why should I even worry about it? You can sit there in the waiting room. I need to go to lunch because there's no real incentive to do a good job for them.